Lithium helps to prevent mood swings. It's anti-anxiety and antidepressant. It promotes neurogenesis. It protects from neurodegenerative disease, and it's anti-aging. It's a soft, silvery, white alkali metal, so reactive that it sparks when it touches water, and it's not found in nature. Instead, it's found in mineral compounds and in mineral water. Cosmologists believe that lithium was one of the 3 elements synthesized in the Big Bang. Most of us associate lithium with treating mental illness like bipolar disorder or mania, or the lithium-ion battery in our phone, which has a tendency to blow up occasionally. It turns out the antipsychotic medication lithium isn't even a drug. It's actually a mineral, and part of the same family of minerals that include potassium and sodium. As a nootropic, microdosing lithium provides some amazing anti-aging benefits. Recent research shows that a low dose of lithium may help to slow the progression of neurodegenerative diseases like Alzheimer's, dementia, and Parkinson's. Low-dose lithium also helps neurogenesis and memory, and it's a mood stabilizer. Lithium calms mania, which is extreme highs and lows, by decreasing sensitivity of the postsynaptic norepinephrine receptor, and it increases the uptake of norepinephrine into the synaptosomes, preventing the release of this neurotransmitter, and the lithium enhances the transport of vitamin B12 and folate into the cells, affecting mood and aggression. Lithium upregulates brain-derived nootropic factor, nerve growth factor, and neurotropin-3, and their receptors, and lithium stimulates the proliferation of stem cells in the brain, all boosting neurogenesis and assisting in the repair of all types of injury. Lithium increases brain grey matter, increasing DNA replication for neurogenesis, preventing apoptosis, increasing N-acetyl aspartate, inhibiting beta-amyloid secretion, and protecting against damage once it's formed. It chelates aluminium and it protects against glutamate toxicity. People have been using mineral springs for therapeutic use for a long time. Studies from around the world have shown the critical health benefits of lithium. One study using data from 27 Texas counties in 1978 to 1987 found the rates of suicide, homicide, and rape were significantly higher in counties whose drinking water contained little or no lithium. Another study of lithium levels in tap water in 18 municipalities in Japan showed standard mortality ratios lower in places with higher lithium levels. Another study conducted in Texas in 2013 confirmed the original findings in the state. Drinking water samples from 226 counties found a correlation between lithium levels and suicide rates. Researchers who conducted meta-analyses of lithium levels and public drinking water suggested increasing the lithium levels of the drinking water could potentially reduce the risk of suicide and justify the administering lithium to the tap water. An article in The Lancet in 1949 by John Cade is credited for the modern medical use of lithium as an effective treatment for manic psychosis. The US FDA approved high-dose lithium carbonate and lithium citrate in 1970 for the treatment of bipolar disorder. Carbonic and citric acid are mineral carriers used to transport the lithium through the body. Doctors also prescribe lithium off-label for treating migraines, seizure disorders, and psychosis. As we dig deeper into the most recently published research on lithium, we realize that this trace element is essential for optimal health and brain function. The lithium that we get from our diet prevents many neurological and psychiatric problems. Microdosing lithium as a nootropic with a supplement like lithium orotate can help to make up for what we don't get from our food and our water. Lithium is naturally available from fish, processed meat, milk, dairy products, eggs, potatoes, and vegetables. Your typical dietary intake of lithium can range from 2 to 600 micrograms per day. Amounts can vary depending on where the food is grown. Recent research has discovered that lithium's mood stabilization effect may be due to its ability to boost the production of new brain cells, or neurogenesis. Lithium inhibits the enzyme glycogen synthase kinase 3-beta. This inhibition upregulates brain-derived nootropic factor and insulin-like growth factor 1, and this stimulates neural stem cells to produce new neurons in the hippocampus. When neural stem cells produce new neurons in the hippocampus, mood and memory work as designed, but a breakdown in neurogenesis results in mood disorders. Lithium has long been known to control mania and to stabilize mood in bipolar patients, but it was not generally thought of as an antidepressant. Researchers in Tel Aviv provided the first evidence that inhibiting the GSK3-beta exerted a rapid antidepressant effect in mice. Another team at Howard Hughes Medical Institute in Pennsylvania showed that feeding mice chow that was laced with a low lithium dose for 15 days produced a dose-dependent antidepressant effect. Lithium induced gene transcription in the hippocampus, the amygdala, and the hypothalamus, all areas implicated in depression, anxiety, bipolar disorder, autism, and schizophrenia. Lithium protects your brain. Your brain cells are at a constant risk of damage from exposure to toxins that you encounter every day in your food, air, water, and your environment, and the excitotoxins produced by ordinary brain cell metabolism. Glutamate plays a major role in the synaptic plasticity that's needed for learning and memory, but overactivity of glutamate on its NMDA receptor causes neuron death and is implicated in Alzheimer's, Huntington's, and Parkinson's disease. Lithium inhibits this overactivity. Lithium also increases the production of a neuroprotective protein called BCL2. Researchers maintain that lithium is the only medication that's been demonstrated to significantly increase BCL2 in several brain areas. Lithium has also recently been evaluated in preventing and treating traumatic brain injury. In a study conducted in 2014, Dr. Peter Leeds stated that lithium had demonstrated robust beneficial effects in experimental models of traumatic brain injury. These include decreases in traumatic brain injury-induced brain lesions, suppression of neuroinflammation, protection against blood-brain barrier disruption, normalization of behavior deficits, and improvements of learning and memory, among others. In 1985, the United States EPA estimated that the dietary intake of lithium from food in the USA varied from 0.6 to 3 milligrams per day. For comparison, people who live in the Andes in North Argentina consume 2 to 30 milligrams per day, with 2 to 3 milligrams just from the drinking water. As your dietary sodium and caffeine increases, so does lithium excretion in the urine, and this increases your requirement for this essential mineral. Your exposure to stress and toxins from things like mercury, aspartame, MSG, bisphenol A, and other excitotoxins also raise cortisol and other stress hormones, increasing your need for more water-soluble nutrients like B vitamins, magnesium, zinc, and lithium. Low levels are associated with depression and anxiety increasing, memory and learning ability declining, insomnia increasing, sensitivity to stress and chronic pain increasing, and natural healing processes declining. Adequate daily intake of lithium could help to prevent many mental health and neurological diseases due to this trace mineral's effect on the nervous system and metabolism, and its anti-inflammatory and antioxidant effects. The clinical research and the studies on the neuroprotective benefits of lithium are so overwhelming that some scientists are beginning to ask, why isn't everyone using lithium? Here's a summary of how microdosing the lithium can help to benefit your brain. It can inhibit apoptosis. The lithium inhibits GSK3, and this has been linked to apoptotic cell death. The NMDA receptor. Lithium reduces glutamate-induced toxicity mediated by the NMDA receptor, and this helps in mood disorders, Alzheimer's, and other autoimmune inflammatory diseases. For neuroprotection, it blocks the development of beta-amyloid tangles and plaques. These are associated with Alzheimer's disease and dementia. For neurogenesis, lithium promotes brain-derived nootropic factor and this is needed for synaptic plasticity in learning and memory. Lithium also boosts nerve growth factor and glial-derived neurotrophic factor, affecting learning, memory, mood, and overall brain health. And for neuronal stem cells, the lithium stimulates the stem cells that are needed to produce new neurons, known as neurogenesis. It stabilizes mood. Lithium is known for providing a calming effect in healthy people, as well as those who are dealing with depression, bipolar disorder, and mania. Adequate levels of lithium have been shown to reduce the suicide risk in multiple studies worldwide. Lithium helps with the treatment-resistant depression. In fact, lithium has been shown to improve the effectiveness of antidepressant medications. And the N-acetyl aspartate. Lithium increases the N-acetyl aspartate, which has been associated with higher IQ scores. The benefits of supplementing with lithium go far beyond just optimizing cognitive health. Lithium also helps to decrease insulin resistance, helps in the treatment of alcoholism and other addictions, supports bone health, balances your circadian rhythm, and more. For many mental health problems, after taking 5 milligrams of lithium orotate, within 15 minutes your mood begins to stabilize and you can begin to feel normal again. Consistent use encourages a happy mood. Many users report that you'll feel the results of taking a low dose of lithium quickly, but for some the full effects can take anywhere from 1 to 3 weeks. Microdosing 5 to 10 milligrams of lithium orotate daily result in consistent results within a month or 2 for some. Many users with depression and anger issues notice results quickly. Within the first couple of days, you should feel more calm, relaxed, and experience less stress. If lithium hasn't worked within a few weeks, the cause of your mental health problems could be from other sources and would require further investigation. For some, lithium orotate means feeling excited about life for the first time in a long time. Anxiety and social anxiety are no longer a problem. Life is more fun and enjoyable. Some say lithium orotate works better than any prescription that they've ever tried to treat severe depression. It provides a nice, smooth mood, balanced without the toxicity that's associated with megadoses of lithium carbonate. If you're dealing with post-traumatic stress disorder or mild insomnia, you might want to try lithium orotate. Focus could improve, racing thoughts could diminish, and motivation levels may increase, and you'll have more coping ability. A study at McMaster University in Canada set out to determine the effects on hippocampal volume in 14 bipolar patients who received lithium therapy. The researchers examined the effects of lithium on hippocampal volumes and memory performance and recall over 2 to 4 years. The patients had not received any type of medication prior to using the lithium. The study found increases in hippocampal volume over time and evidence of improvement of verbal memory performance over the 4-year measurement period. The researchers concluded that the results of the study were consistent with the literature stating the neuroprotective effects of the lithium, and that long-term treatment of lithium is associated with preservation of memory and recall due to increased hippocampal brain size. 24 adults recovering from heroin or methamphetamine addiction participated in a study in San Diego. Group A received 400 micrograms per day of lithium taken orally for 4 weeks. The placebo, Group B, naturally took a non-addictive placebo. Subjects completed a mood test questionnaire containing questions about their ability to think, work, their mood and emotions. For the lithium group, mood test scores increased steadily and significantly during the 4-week period. The lithium group also reported significant increased levels of happiness, friendliness and energy. Group B showed no improvement during the same period. The research concluded that the low-dose lithium provided a mood-improving and stabilizing effect. In this study, 42 alcoholic patients were treated with lithium orotate during alcohol rehabilitation in a private clinic setting for 6 months. The data was collected from clinical practice records for the 10 years following the initial study. The patients received 150 milligrams of lithium orotate daily for 6 months, along with calcium orotate, magnesium orotate, bromelain, and essential phospholipids. 10 of the patients had no relapse from 3 to 10 years. 13 patients stayed sober from 1 to 3 years. The remaining patients relapsed between 6 to 12 months. The researchers concluded that the lithium orotate therapy was safe in treating addiction with minor adverse side effects. Lithium retains a grim and undesired reputation, likely because it was originally associated with serious mental illness, and like most medications, lithium can produce serious side effects if not monitored properly. Lithium carbonate, or lithium chloride, is typically prescribed for long-term control of bipolar disorder at 900 to 1000 milligrams per day. The major problem with such high doses of lithium are some very serious and debilitating side effects. For the nootropic use, it's suggested lithium orotate, which typically contains only 5 milligrams of elemental lithium, bound to orotic acid. Orotic acid reportedly makes the lithium more bioavailable than lithium carbonate. The lithium is released once it crosses the blood-brain barrier, so you get the benefits of the lithium supplementation while avoiding the toxic side effects of the high doses. Lithium orotate recommended dose is 5 milligrams 2 to 3 times per day. Many neurohackers use lithium orotate only as needed, for example when feeling anxious or in the middle of a mood swing. For some with bipolar disorder or manic disorder, increasing to 2 5 milligram tablets up to 3 times per day may be effective. Naturopathic doctors suggest also taking 1000 milligrams of omega-3 and 400 international units of vitamin E as a mixed tocopherol each day that you're using lithium orotate. Don't confuse lithium orotate with lithium carbonate. The carbonate version of lithium is only available by prescription and it comes with a host of side effects. Lithium orotate at low doses is non-toxic and lab tests are not required to monitor your lithium levels because it doesn't show up in blood samples. Lithium orotate should not be used if you're dealing with significant renal or cardiovascular disease, severe dehydration or sodium depletion, or if you're taking diuretics or ACE inhibitors. Don't use lithium orotate if you're pregnant or breastfeeding. You should check with your doctor if you're using any medication before combining it with lithium orotate. Lithium combined with orotic acid makes lithium orotate, and this readily crosses the blood-brain barrier, and you should feel its effects within 15 to 20 minutes of consuming. Lithium orotate is especially effective if you're feeling stressed or mentally overworked. Your brain uses lithium faster and it needs it to be replaced, which you can do by using lithium orotate. Lithium orotate is great if you're dealing with ADHD because the lithium calms the hyperactive part of your brain. Supplementing with lithium does not change your state of consciousness. It simply helps to bring you back to feeling normal and happy. Try a first dose at 5 milligrams to see how it reacts. If you experience no negative reaction, you can try another 5 milligrams in a few hours. You'll likely experience the full benefits of lithium orotate within 1 week of consistent use. For more information about herbs, supplements, and treatment plans, check out my website.